I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing last week on the federal response to the opioid crisis. During the hearing, Congresswoman Virginia Foxx connected fentanyl deaths to border security. She compared the Trump administration's border policy to the Biden administration's and then claimed the current one is, quote, allowing opioid overdose deaths to continue increasing. Listen in to how the director of the White House Office of National Drug Control Policy responded.
Representative Cloud, you are now recognized.
Madam Chair, I believe this is Virginia Foxx. I think I'm on next.
Oh, we were by your.
That's fine with me. She can go first.
Thank you, Michael. Thank you, Madam Chair. Dr. Gupta, it's interesting to me you say behind the walls. You're just, it's impossible for you to say people in prison, I guess. Dr. Gupta, what percentage of drugs coming across the southern border are fentanyl or laced with fentanyl?
I can speak about the seizures. I do not have the direct data on the amount of percentage.
Of the seizures.
The seizures, the volume of it, because most of those seizures.
Now, just what percentage are fentanyl or laced with fentanyl?
I can get you that data, Congresswoman.
Okay, I think it's most of them. Since fentanyl is one of the deadliest drugs that's coming across the southern border, what policies has this administration implemented to stop it? And I'd just like you to say 1, 2, 3, 4 policies. Don't go into extraneous information, please.
Yes, Congressman. So first of all, we are there's a United States-Mexico bicentennial framework that is looking at particular policies that fuel the trafficking, they fuel the transfer across the border, and work with Mexico as a partner to make sure that we're working on that. The second, President signed executive order that expands the prosecution and placing of sanctions to not just individual traffickers, but also the enablers, the financiers. We have already, and I'll can provide details later on to you.
Okay, so the first thing you gave, nothing, there's nothing in what you said. It's a working on an agreement. So nothing there, you're saying just one thing, and I'll look for the details. So during the Trump administration, we saw the first annual decrease in overdose deaths in 30 years, with the Trump DHS setting an all-time high for the amount of drugs seized at the border, and the Trump administration awarded a record amount of federal grants in support of drug interdiction and public health programs. What can we do to replicate this kind of success moving forward? And why hasn't the Biden administration already kept those programs in place?
Thank you, Congresswoman. I was a West Virginia Health Commissioner at the time, and I can tell you that during 2018, the deaths from fentanyl actually went up by 10%. So the decrease was not, unfortunately, in fentanyl during that time. What we are seeing now, 2 weeks ago, CDC provided its first 12-month numbers that have shown a few hundred decline in the deaths for a 12-month period from month to month.
Okay, well, let us have that information. We'd like to be able to compare what happened during the Trump administration with what's happening, because that's not what we understand. The Trump administration's stance on securing the southern border helped make America safer, stop the flow of opioids into the nation, and reduce overdose deaths. But the Biden administration's stance on the border is making us less safe and allowing opioid overdose deaths to continue increasing, despite what you're saying. So without addressing our southern border security, we simply cannot stop the flow of fentanyl into the country. According to the CDC, in 2021, more than 107,000 people died from drug overdose, up from 91,799 in 2020. Why has the Biden administration failed to bring down drug overdose deaths?
Thank you, Congresswoman. I believe we are seeing now a blunting of the curve of overdose death. We know there's multiple factors. We also know that it's very important to secure our border and continue to secure our border. That's exactly why President Biden has proposed a budget of increase of $300 million for Customs and Border Protection for the drug budget. It's really important that we provide the men and women on the border in uniform the resources, the technology, as well as the infrastructure that they need to do the job that they're supposed to do.
Come on, Mr. Gupta, you can't believe that. Let me ask you one more question. As a physician who served in rural communities, like many throughout my district, can you describe what should be done to protect rural communities from fentanyl and other dangerous opioids?
Thank you, Congresswoman. I think first of all, we got to get naloxone out there, make sure we can prevent about 80,000 deaths, a majority. If we can get naloxone out there, then connect people to treatment. We also need to have a robust law enforcement drug trafficking efforts to make sure that we're cutting into the profits. That's where the high intensity drug trafficking area or HIDTA programs are important, because they're bringing local, state, and federal partners to work collectively. And they're doing a great job at interdicting that supply right now. It's a combination of both public health and public safety, especially in rural communities.
You seem to know what to do, but you're not doing it. Thank you, Madam Chair. I yield back.
Time has expired. Representative Lynch, you are.